Leg pain can happen to you at any age of your life. You could be 5, you could be 60, but you will experience leg pain, and it is very important always to ask yourself why. But for most of us, we may just think, it's just something that will go away, so maybe let me just eat some molokoni or let me drink herbs and I'll be fine. But I am here to tell you that's not the thing, because from my research, it goes deeper than that, and you could be having an underlying problem. That's why we are here today to discuss leg pain in all age groups here on NTV Medical Matters. You are welcome. I am Viola Sasia, and we are supported by Bill and Melinda Gates Foundation. We have our doctor in studio already, and we shall be having this discussion on leg pain. You can catch it on our social media platforms at NTV Uganda, but I'll give the doctor now a chance to introduce himself, and we shall dive in.
Thank you. That was a good introduction. Good morning, NTV and the rest of the world. I'm Ambrose Asimwe. I work with Capital Center Medical Clinic in Bwaisi, and I'm glad to share with you about leg pains.
Okay, so Ambrose, we are going to start off with the basic structure of a human leg. Yeah, for somebody it might be from right here on the hip up to the foot, but maybe you might know a leg to be different. So please talk to us about the structure of a leg. What is it made of?
Normally, a human being will have 2 legs. And about a leg is that part of your body between your groin and the ankle joint or the foot. When I talk about the leg, I mean that area between where your hip starts from.
So I was right.
You were right. You did some good research.
Wouldn't somebody say it's a thigh? What's the difference?
No, the thigh is part of the leg.
Oh, wow.
Because you see, when we start from the hip, the hip is a joining of the bones of the pelvis and the femur. Actually, what people call the thigh bone.
Yes.
It's called the femur. Okay. So that's where we have the hip joint, right from the pelvis down to the ankle joint to the foot. That's what we call the leg. So when we talk about the leg, we shall have the upper leg and the lower leg. Now the upper leg has some structures, and the lower leg also has some structures. But generally the leg is a structure that has bones, like you see the femur, the thigh bone, the tibia, the fibula, the bones of the foot. Because we may not talk about the leg without talking about the foot.
I'm wondering whether the foot is part of the leg.
we shall see. But now we have the bones.
Yeah.
The leg has bones. The leg has muscles. The muscles are very important because they help a person perform movement.
Yeah.
For a joint to move, I'm going to talk about joints. For a joint to move, for you to be able to move your knee, for you to be able to move your hip, you need muscles. So the leg has a number of muscles. Like you see, the thigh, the front thigh, those are muscles. The behind thigh, we have muscles. We have the calf muscles, what people call entumbwe, the muscles of the leg.
Yeah.
The leg needs blood supply. For every part of the body to function properly, we need blood supply. So the leg has blood supply. So we shall talk about the arteries of the leg and the veins of the leg. The arteries are these blood vessels that are going to take blood to the rest of the body parts. And the veins are going to get blood from the rest of the body and back to the heart.
Before we talk about how all that aids movement, where do the nerves come in?
I was coming to the nerves because the nerves are the other part of the leg.
Yeah.
So the leg needs a nervous system. For a muscle to contract and perform movement at a joint, it needs stimulation from the nerves. So the nervous system of the legs is also important. We have a number of nerves in the legs. We have the common peroneal nerve, we have the tibial nerve, a number of nerves that are important for muscle work. Because for a muscle to contract, there must be stimulation from the nerves. Then we also have skin of the leg. The skin is also an important part of the leg.
I'm just using mine as an example.
Yes, the leg is a complex structure that has a number of bones, a number of muscles. blood vessels, and the nervous system. And actually what we don't usually talk about is the lymphatic system. The lymphatic system, which is very important
And
in
that's
the leg.
very, you bring it up and I like it because I remember one time when I got ill, one of my bosses told me to lie on my bed and put my legs up on the wall.
Yes.
What does that do?
The science was finding a way of improving blood saturation.
And I had no idea. I just did it.
Yes, because when you elevate the leg, you aid venous return. Some people have issues with blood saturation. They have swelling of the feet.
After
Did you
travel,
have a lot of swelling?
After long travel, no, it was actually that time of COVID-19.
Okay.
I was just sick, couldn't
sorry.
breathe well.
So elevation of the limb, elevation of the leg is sometimes helpful when you are managing edema, or what we call swelling.
Yeah.
So basically, the leg has a number of structures. So if there is any concern with one of the structures I have mentioned, it could be the bones, it could be the muscles, it could be the nerves, it could be the blood vessels, or any injury to one of those parts or a number of those parts, we could end up getting leg pains.
Talk about the coordination. How do all of those things you've mentioned coordinate to help with movement?
The function of the leg is to help you in locomotion, to walk.
And to play football.
Exactly. So for you to be able to do that, you need joints.
Yeah.
So the joints, I didn't talk about the joints actually. We also have the joints. The joints are the joining of the bone to a bone. Where a bone meets another bone, we have a joint. We have one or two more bones meeting, we have a joint. Like you see the hip joint, particularly when we are talking about the leg, we have the knee joint, we have the ankle joint. All these joints are very important. The joints are very important in supporting your body weight and in locomotion. So to be able to move those joints, you need the muscles. And for the muscles to contract, you need the nerves. For all these parts to be working properly, you need proper blood saturation for you to be able to move and use your leg.
Let's talk about blood circulation. And in what cases have you found that somebody had a challenge with blood circulation? What would cause that? But above all, what's the importance of having blood circulation?
Blood circulation is very important because in blood, we have oxygen, very important for most processes of the body. We have other nutrients, minerals in blood. So blood saturation, in most cases, we shall see this as one of the causes of leg pain under blood saturation. There are people who have had blood clots
in the leg.
In the leg. It could be the lower leg or the upper leg. It could be the calf or the thigh. An example, when you have a blood clot, it is going to disorganize the flow of blood. And this could affect a lot of things in the leg.
Yeah.
We could have swelling because blood is not moving properly. We could have pain. People have had blood clots. Sometimes they get what we call throbbing pain. They feel the leg is heavy. Because of poor blood saturation, we could also have issues with the color of the leg.
Yeah.
We could see some changes in color, or you feel that your leg is somehow cold because of blood clot.
That has happened to me before.
Yes. The science of blood clot, before I go any further, is very important when it comes to massage. There are people who do massage and they don't mind people having blood clots. Once you massage massage someone's leg and they have a blood clot, you could put the person at a risk of death.
Are you talking about the massage therapist causing the blood clot or finding it there and not?
There are people who do massage even when they are not massage therapists.
Oh yeah, there is this person who squeezed my body. I almost passed out.
Exactly.
Now, asked myself, is this massage?
In a scenario that someone has a blood clot, you could force this blood clot to move.
I can see where you're coming
to the rest of the, actually close to the lungs.
Yes.
And this could be dangerous to someone's life. So the science of blood clot is very important when it comes to blood saturation. Still, about blood saturation, we may talk about what we call the varicose veins.
I've heard of
you have seen Some people having varicose veins. Some people have seen the pregnant mothers have them, but also people have a lot of weight.
What are those? Those green
Those
veins?
funny veins you
They are
might see on
green
your
or
legs.
blackish
They
or
have
something.
changed color. They are big,
You have seen
sometimes
them.
painful.
You have seen
You might even feel itching around that area. Very, very dangerous. Because when vessels have to work so hard to get blood back from maybe the parts of the feet, from the lower leg to the back, to the heart,
Yeah.
then sometimes these vessels will have to twist. They bulge. That's why you see them increase in size.
Yes.
Also painful. So varicose veins can be painful. Very common among pregnant mothers. We have seen varicose veins in people who sit for so long, who stand for so long. We have seen some police officers with varicose veins. Then people have had obesity, overweight. Yes, very common.
What nerves are responsible for sensation and movement in the leg?
When we talk about the nerve, we mean the sensory part and the motor function part. The nerves have branches. They are nerves that will go to the skin to give you sensation. That when someone touches your leg, you will feel someone has touched me. When you step on fire, what will tell you, please remove your leg. That is a part of sensation, the sensory function of the nerve. Then there is motor. Motor means muscle function, movement. For you to be able to perform movement, you need nerve function. We see the most common nerves we have in the leg are the tibial nerve and the common peroneal nerve. Any injury to those nerves, we might have issues with paralysis or sometimes pain.
And we shall talk about paralysis more, because I've also seen, I had an incident where one of my schoolmates got an injection and their foot turned the other way around.
Actually, that is common in children. We shall talk about how children can develop leg pain because of injectionitis. Maybe they injected somewhere in the nerve, and maybe they disorganized the system of nerve function.
You've also heard about this, and this has happened to me personally, where my foot sort of wants to turn the other way. I don't know how to explain it, but it's like it.
When you're walking?
No, when I'm just lying, I could twist it in a funny way and tries to become lame, I guess, because I saw, and it really sounds funny, but it happens.
Sometimes it might not be nerve function.
What is that?
It might be issues to do with stretching, muscle work. Yes, sometimes cramps.
But those are foot cramps, right?
Yes.
I think I'm talking about foot cramps.
Exactly.
That's what I've had, and I always find it so bizarre.
So they are different from the nerves.
Yes. What exactly is leg pain?
Leg pain is any discomfort or pain you might experience in that part of your body between the groin, between your areas of the hip and the foot. Any discomfort or pain, we shall call it leg pain. Leg pain, like we started, can develop differently.
Yeah.
We might have people who develop leg pain which comes and goes away. There are people who will get leg pain that will stay there for so long.
Yeah.
There are people who will get leg pain in a small part of the leg. Maybe it could be around the thigh, around the knee. Then there are those who will get it generally in the whole leg. Someone tells you, I feel pain in the leg generally. They can't even tell you that the pain is here, but they feel it inside the leg. There are people who have sharp pain. There are people who get dull pain. Pain is also different for everyone. There are people who get burning pain. Burning is also some sort of pain. Then tingly sensations in the leg, some sort of pain. There are people who could get numbness of the leg. They have some sort of pain and also numbness.
Yeah.
It is hard to explain when these patients come to the clinics to the hospitals, they even find it difficult to explain what
What's
happens.
happening.
But what we should know, leg pain can be frustrating. It could be a dull pain after a long day, you have been standing for so long. It could be sharp cramps, maybe at night. It could be soreness of the leg after a workout. You have been exercising in the gym or outdoors and you get leg pain. Leg pain can be frustrating. But what we should know is that leg pain is different for everyone. Leg pain for patient A is different for patient B. And that's why for us, we always ask these patients to come for individual assessment. What is very important, why assessment is very important, there are people who have had leg pains, but the origin of the pain is not in the leg. Someone tells you I have leg pain, but the cause of the pain is not in the leg.
What
the
is
leg
that?
is very okay.
So what
In
is
most
that?
cases, the problem usually comes from the lower back or the spine. Someone has an issue with the back, has an issue within their pelvic area, and this pain is radiating down the leg. They are feeling the pain in the leg, but the origin of the pain is somewhere else. So when they go for checkups and they find the legs are okay, and they be like, nabuse dagala.
I have actually
they
had
bewitched
that,
me.
I had that kind of pain as well, but I got physiotherapy. It was from my lower back, and
Exactly.
it radiates up to close to the knee. It was going through my
Usually
my
it
left.
is nervous pain. It goes
Yeah.
through the nerve.
Wow.
People have had sciatica.
Yeah, that is what I was told. Yeah.
People have had sciatica. The sciatic nerve right from the lower back, from the lower spine, can have issues and you get pain down the leg. So if you put emphasis on only the leg, you will miss out on the origin of the pain in the lower back. That's why it is very important for us, healthcare providers, to examine and assess the patient to identify the cause of pain.
And I believe for us patients to be able to explain properly, to say, for example, I had cramps, perhaps that could have sent pain down my leg, or something, just to be able to explain. We play a role here too, I would want to believe.
That's why we come every time and teach them,
Yes.
such that we make it easier for them also to explain to us. Because once we understand them, once we understand their issues, we shall help them.
Absolutely.
The most common cause of leg pain,
I was actually going on to that. What have you seen?
it is among the elderly group of people. When I talk about the elderly group of people, people usually ask me, what is that age?
Are you saying I'm old?
We usually say 50 years plus.
Okay.
Sometimes in women, we say 45 years
Oh,
plus.
no.
In women, it's usually earlier. But we usually see people get pain, leg pains, because of osteoarthritis. Arthritis is one of the common causes of leg pains, and especially in the elderly group of people. Because as we age, we expect some changes in the bones.
How would you describe it, arthritis,
Arthritis,
to someone watching?
arthritis is wear and tear changes. Wear and tear changes in the bone because of aging. Like you get your shoe when it's new, when you continuously use it, repeatedly use it, we expect some changes. So now we have cartilages in between the two bones. An example is the knee, where two bones, the thigh bone, the femur, where it meets the tibia, they are going to make the knee joint. In between, you have the cartilage. So when we have continuously wearing off of these cartilages, these are just soft structures that prevent the rubbing of the two bones. So we can end up having pain. People who have had arthritis, they know what I'm talking about. They have had painful joints. It could be the knees, it could be the hips. Sometimes with swelling,
Does that mean that
stiffness.
does that mean that the cartilage is wearing off, and so the bones are rubbing together?
The bones are rubbing
Oh, dear
together.
Lord. Yeah.
And this causes pain.
Yeah.
People will tell you, I find it difficult to go to the toilet,
Oh dear God.
to squat, to bend,
Okay. Yeah.
to walk. People have had issues with walking because of osteoarthritis. I'm very specific with osteoarthritis because you have other forms of arthritis. But I'm talking about osteoarthritis.
Is that the common one?
The common one, especially among the elderly. There are people who are in 40s and they have had osteoarthritis, even in 38, especially when they have had history of a previous injury. They got an accident some time back, and this injury was not properly managed. They are at high risk of developing early osteoarthritis.
And I will just jump the queue for the questions or our discussion, because I don't want us to leave that point before we offer some sort of solution, because we may forget and continue. But on that particular point for arthritis, what are some of the foods that can aid somebody recreate that cartilage that is aging?
Exactly, very important. When we are talking about the musculoskeletal disorders or injuries, the foods we are going to see, we need calcium, very important. Of course, we need other foods. We need proteins, we need carbohydrates, but we need calcium, we need magnesium, we need potassium. So taking your milk is okay. Sweet potatoes are okay, very important. Green vegetables are very important. But still, when we talk about osteoarthritis, exercising is very important, and managing your weight. Exercise, diet, managing your weight is very important when it comes to osteoarthritis. People who sit for so long, they're at high risk. You need to exercise your body. Yes. Osteoarthritis has no cure, but we have treatment modalities that are available to manage the symptoms, and people can live happily with osteoarthritis.
Awesome. How can somebody tell the difference between muscle pain and joint pain in the leg?
Muscle pain usually is within the muscle. Joint pain is usually within the joint. But there are people who have had muscle pain and it affects the movement of the joints. You see, muscle pain, it could be pain within the muscle. There are pains that could develop within the joint.
Yeah.
But a person might have a problem with a muscle and gets pain within the joint.
And I've noticed that pain in the legs likes to radiate. It does radiate to the surrounding areas.
To the surrounding areas, yes.
That's
You
what
could
I've
have
come to
pain
say.
in the hip area, and the pain surrounds, the pain goes almost
It just literally goes
to
miles.
the whole leg.
Yeah.
Yes, it's very important because pain is different for everyone. We have trigger points for pain. You could tell me that you have pain in the thigh, but when it's actually coming from your buttocks. When your pain is reported in the back thigh, but when I examine you, the pain is in the buttocks. And actually, when we talk about leg pain, we might not even fail to talk about the buttocks.
Yeah.
Because the muscles of the buttocks muscles are very important in the movement of the hip, in locomotion. When you have issues with the buttocks, you'll have issues with locomotion. The other common cause of leg pains is injury. When you talked about muscle pain and joint pain, it brought me to injury. You could have injury to the muscle. You could have injury to the joint. And the most common cause of injuries are road traffic accidents.
Yeah.
You could get a fall, maybe from a motorbike, you're in a car. Maybe, who knows, you get a fracture. A broken bone can cause pain in the leg. That is most obvious. A broken bone, that is a fracture. It could be a fracture of any bone of the leg, even if it is the thigh, even if it is the lower leg. It could be the tibia or the fibula. You could develop leg pain. We could also have leg pain because of a wound.
Yeah, and we shall pick up from there. We also have to look at whether all leg pain is something to worry about, or whether some leg pain can be lived with, can be ignored, and you just take Panadol and go about your day. NTV Medical Matters is taking a break, but when we return, we shall be coming back to talk about leg pain. Still be a part of us. Do not go away. We shall be right back. Welcome back from that break, and thanks for staying with us here on NTV Medical Matters. I am Viola Kusasera. We are supported by Bill and Melinda Gates Foundation, and in studio today to discuss leg pain is Dr. Ambrose Asimwe. Before we broke off, we were speaking about, you had brought up something important.
About
that
the
pain
wounds.
can come from the wounds.
Yeah, you could have a wound on your leg. These are most obvious causes. You might have a wound on the leg and you get painful legs. You get pain somewhere on the leg. But there are people who have had bad wounds, especially when we talk about diabetes. Diabetes. Wounds that are not healing can cause chronic leg pains. Very important. Leave alone these minor wounds. But wounds that are not healing properly can cause long-term. When I talk about chronic, I mean long-term leg pains. It could be a wound because of, it could be a gunshot wound.
Yeah.
Yes. It could be any dangerous instrument, object.
Yeah.
Whichever wound you might have, you could end up getting leg pains. Then I could talk about something interesting about blood vessels. I had forgotten about the arteries. For people who smoke, I usually want to talk about lifestyle issues. People who do a lot of smoking and alcohol, they are at high risk of having their arteries getting narrowing of the arteries, small in size.
Is that,
and this
because of fat?
No, because of interfering with the function of the blood vessels. Not even necessarily the fats. But when you have narrowing of the arteries, there is a condition what we call peripheral artery disease.
Yeah.
Very common in the people who do a lot of smoking and taking a lot of alcohol. The substances in cigarettes, they interfere with blood saturation, by the way. And whenever we interfere with blood saturation, where we need blood to be,
It does not go.
it doesn't go. We shall have issues. We shall have these patients tell you, whenever I walk for 2 minutes, I get tired. They get fatigue all the time. They can't walk for so long. When they take rest, they are okay. They feel fatigue all the time. The legs are heavy. So these patients are there, and they could end up getting leg pains. You see, we are digging deep into the most common cause of leg pains, and I want to show people why they need to come for assessment to determine the cause.
As you
of
speak
the
of
pains.
that, is all leg pain something to really worry about? Those dull aches can be ignored and you just do your work.
Yes, we shall find out. Actually, most of the leg pains can be treated at home.
With what? Herbs?
With some, let me use the word, can be managed, not treated, managed. With some home care remedies. Someone gets painful legs, maybe a painful cramp in the leg, they put a warm cloth and they feel better. They do some massage, they feel better. They do some exercise, some stretching, they feel better. But there are people who get pain which is severe, sometimes sudden, or persistent, or sometimes that comes along with other signs and symptoms. Because there are people who get leg pain, but there are other symptoms like swelling. When you have leg pain and you have swelling, change of color of your leg, sometimes redness. The leg is warm, also cold. I don't see why you are staying at home. Let me talk.
But you can go to a hot spring.
Yes, you can go to a hot spring, but you need to know what could be causing all that trouble.
Yeah, that's very correct.
You might even feel numbness of the leg.
Yeah.
I was telling you these dangerous signs and symptoms. You feel your leg is heavy. You cannot move your joint. Now I'm asking, why are you staying home when you can't move your knee, when you can't move your hip, when you can't get out of bed? It is so late.
Okay, let's look at causes and conditions. What are some of the common conditions that may present as leg pain?
As leg pain, leg pain is a sign and symptom. It's not a medical condition. It's a sign and symptom
Of something else.
of something else.
Of something else.
Yes.
So how do injuries like sprains and, and strains, maybe you talked about fractures, affect
Very common
legs?
among sportsmen and women.
Yeah.
Women are also in sports.
How differently do they affect the leg?
There is what we call a muscle strain. A muscle strain, a muscle stretches to some level. But when it goes beyond that level, it could get injured. And that is called the muscle strain. You overstretched the muscle. It has gone beyond. Then for a muscle sprain, for it can be more painful or dangerous than a muscle strain. Because a sprain will include other structures, that is the ligaments. The ligaments support the joints.
Yeah.
The ligaments are important structures that support a joint. So when you overstretch a ligament, when you get a ligament injury, or sometimes a ligament tear, that is a serious injury that needs treatment, and it could cause a lot of pain. Common among sportsmen and women. There is another injury that is common. We have seen the hamstring injury. People who play football, the hamstring, the back thigh. The hamstring is a muscle. The back thigh is what we call the hamstring injury. So we have seen people get a hamstring injury because of overstretching of that muscle. Maybe they landed badly on the ground, or they don't stretch these muscles properly, and they are at a high risk of getting a hamstring injury. And we also have other ligament injuries, especially the ligaments of the knees.
Yeah.
They are very common causes. The ligament injuries are one of the common causes of injuries in the leg, especially to the knee joint. Yes.
And this question is about some of us who work, you know, sitting at for long hours at your computer or your desk. Can that cause pain that may come from the back to the leg?
Yes. Sometimes pain that is temporary, or sometimes this pain comes gradually and stays there for so long, chronic, because of sitting for so long. You see, when we are sitting for so long, the knees, most of your joints are in one position for so long. We might have muscle imbalance. Some muscles are bending the knee. Some muscles are not straightening the knee. So some muscles are performing their work.
Yeah.
Other muscles are not performing their work. That is what we call a muscle imbalance. That might cause pain. Then still, when you sit for so long, you could cause trouble to blood saturation. And blood saturation is very important. When we have interference with blood saturation, we can end up getting leg pains.
How does physical activity affect or impact leg pain, both negatively and positively?
So, there is overuse and misuse. Now, this is the science of overuse. You can overuse your leg.
Yeah.
It's good to use your leg. We are saying, yes, use your leg. You need to exercise your leg. But you might do more than what we expect, more than necessary. People walking for so long. And mind you, these people are not used to that walking. Like there's that event coming in June when people walk to Namugongo.
I don't like to walk.
There are people who will do that, but they have not been practicing the walking.
Oh, yeah.
And we walk long distances.
From my home
we have
village.
seen them on TV complain of leg pains.
Oh my God, from my home village till here.
Exactly. Because that is overusing your leg muscles. You are doing more than what you expect.
Yeah.
Then there is misuse. You are using your leg, not necessarily for a lot of time, but in a poor way.
In the gym.
You are putting on high heels for so long.
You're talking about me.
High heels. If it is done occasionally, that would be understandable. But this is done repeatedly.
Somebody tells you I'm addicted to heels.
Exactly. In the office, when walking, and it puts a lot of stress on the muscles, on the joints of the leg.
Yeah.
And who knows, in the long run, you might end up developing leg pains.
And what are key signs in the legs? That key signs of okay, leg pain can be felt, but what are some of those warning signs you should
Warning
not
signs.
ignore?
Warning signs that you should take serious, that need medical attention.
Yeah, immediate.
When you get painful legs, and the pain has come suddenly without any explanation, don't stay home. That needs medical attention. Leg pains that come suddenly without any explanation. You have leg pains, you have swelling. You can see this with your eyes. You have swelling. You have had leg pains after an injury. Maybe you fell down, you were climbing a tree, accidentally you got down, don't stay home. Leg pains with fever, chills, loss of appetite, headache, don't stay home. Leg pains with paralysis, some sort of paralysis. You have severe back pain, don't stay home. You cannot move your joint of the leg, especially the knee. You cannot move your knee. The knee is swollen. Don't stay home. You have a slow healing wound and leg pains. People with diabetes, you know better. Don't stay home. I'm not saying that people who have these wounds are all diabetic. No, you could have a wound that is healing slowly when you don't have diabetes.
I actually saw a diabetic patient. We interviewed her on the show. She stepped on something sharp. It entered her foot, but because she had no sensation, as we were saying, she kept bleeding. Somebody told her, but you're bleeding. And she's like, what? She checks down and she's bleeding. So
that's why wounds in diabetic patients are very dangerous. And we need to manage them with urgent, immediate attention.
And maybe if I should just say, like, diabetic patients must make sure they wear very hard shoes.
Exactly.
To stay away from
and take care of their feet.
Yeah.
Sometimes do the massage, do the exercise, improve blood saturation. Blood saturation is important in healing of wounds. And for diabetic patients, sometimes we have neuropathies. They actually get leg pains because of the effect of diabetes on the nerves. They also get leg pains. Very common in diabetic patients, the leg pains.
When does leg pain become a medical emergency?
Especially when someone has severe low back pain. Because we could be dealing with the spine and sometimes also the spinal cord. So we don't need to stay home. Very important, yes.
We've had people's legs getting cut off.
And also, of course, maybe cuts, injuries, fractures. There are severe fractures that could also put a lot of danger to the arteries and the veins, the blood vessels. Yes.
When do medics decide to cut off somebody's leg?
Especially when we have issues with blood saturation. We have had death of most of the tissues. The tissues are not getting blood. We don't have any function. So it's better we lose the limb, not affect other parts of the body. Yes.
So are there specific patterns you've observed during treating patients with leg pain that could point to nerve damage or nerve problems?
Yes, especially issues to do with irritation of the sciatic nerve. It could be at the lower back, it could be around the buttocks area, it could be around the thigh. And someone complains of leg pain, and seriously, it could be an issue with the sciatic, particularly an issue with the sciatic nerve. That pain can be...
I had it and it humbled me very well.
Exactly.
Put me in my place.
And it's not easy. It doesn't go away so easily like that.
Yeah.
We didn't talk about the children. Remember, I don't want
You had brought them up actually.
I don't want to forget that. The children you also can develop leg pain. First of all, they are what we call normal pains in children, what we call the growing pains when the children are growing. Normal pains. The children usually report these pains at night. Those ones okay. But a child can also get an injury. A child can get a wound. A child can get an injection on one of the areas of the leg, and they get pain.
But speaking about, sorry to cut you short, but speaking about injection, I think we need to talk about them before we forget. I have seen multiple people suffer with those injections. So when somebody is injecting somebody on their behind, how do they decide this is where I'm going to inject? This is where they hurt people's nerves actually.
Of course,
and they go
the
lame.
medics will have the science of the anatomy. They know where they are supposed to inject.
So how does it go wrong? Because I've seen 2 cases.
You know, sometimes accidents happen. Accidents happen. Sorry to those who have had this. This happens to some children, yes, and we end up having a condition called injection neuritis, where they inject on one of the nerves that passes on the behind of the child, like you said.
Yes.
And whenever we irritate the nerve, we can end up having these 2 things. We could end up having pain or sometimes paralysis or numbness. We have seen these children lose some function of their leg. You see how they walk, how they stand,
Their leg is
the function of the foot,
Yes.
almost having a foot drop.
Yes, I saw that.
But the good news is that that is managed.
It's manageable.
It's manageable in the hospital.
But
It could need medication, it could need physiotherapy, and your patient will get better.
Can leg pain cause mobility problems that we may underestimate?
Very much, very much. When you have issues with your legs, especially pain, it makes it difficult for you to move the joints, to stand. And whenever you stand and you have pain, you might end up standing with a poor posture.
Yes.
Because you are shying away from pain. An example, when you have pain, maybe in the right leg, you might end up going on the left side because you feel when you stand properly, there is a lot of pain that goes to the right leg. So that will cause more issues with the spine, and you develop other complications.
For standing on the wrong, for
Exactly,
standing
and even
in a poor way.
compensatory movements, compensation that will come in your body and will cause more pain. Yes,
So
leg pain is very dangerous.
So Ambrose, in a clinical setting, how do you typically diagnose leg pain to find out the specific cause?
Patient history is very important. Well, first of all, we listen to the patient. Clinically, that is very important, to listen to the patient. They will tell you, I feel this, I feel this. I feel this pain is throbbing, is sharp, is dull. Someone will tell you, I feel like I have pus.
But some of us can't explain properly.
For those who will explain. Then for those who won't explain, no problem, we shall find out. So after we have listened to this patient, we find out what might be necessary. We shall do some physical exam. A physical examination and assessment is very important. People usually don't take it serious. When they get leg pain, immediately they want to go for an X-ray. No, that is bad. Not every leg pain will need an X-ray. We need a scan. They are going to miss out some information. Someone might have leg pain, and the pain is within a muscle. Some muscles are stiff, and it won't show on an X-ray. And when they go, you might have leg pain, and when you go for an X-ray tells you everything is normal, but you still have leg pain. So physical examination and assessment is very important. Then, if we do this exam, we have done some leg tests for some muscles, for some joints. We have assessed muscle power, muscle strength. We have seen all that. Joint mobility. Are you able to move your joint freely to a full range of motion? Can you move your knee fully? We have assessed all that. If there is need, we shall say, let's go for an X-ray. Maybe to investigate more about the pathology we are seeing. Maybe this person has a swelling of this leg because probably they got a fracture. Yeah. We need to see whether we could have gotten a broken bone. Sometimes we could go for scans, an MRI scan, ultrasound scan.
So those come after physical exams.
Very important.
To not rush
it's
to
the doctor who should send you for an MRI, for a scan, for an X-ray. Not you saying, for me I feel pain in the leg, let me go for an X-ray.
Are there points where you've had a hard time, you or your colleagues have had a hard time pinpointing the exact cause of the pain? And somebody tells you, I have pain, but you cannot find
very much. And you see, that's why it is very important for us physiotherapists, the advantage we have is that we usually see these patients for a number of sessions. It's not a one-day thing. There is some stubborn pain. That one I admit, there's some stubborn pain. And you need to continuously examine and assess the patient to know what could be the cause of this pain. This patient is complaining pain around the knee area, but where is this pain coming from? You find out that someone is complaining of knee pain when the cause of the knee pain is not the knee. The knee is very okay, but some problem with the thigh is causing the what?
Legs are very interesting.
Legs are very interesting.
They're very interesting.
So,
so now, let's move on to treatment and management. What are some of the most effective
so after we
ways?
have had assessment, we have done the necessary investigations, which could be laboratory. I didn't talk about that. Someone can have leg pain, and we need to do some blood tests. We need to do some tests in the laboratory.
Yeah.
So we have also done the radiological investigations, that is the X-ray scan, or other tests. Then we come to treatment. Treatment is different for everyone. But what we should know that treatment for leg pains will depend on the cause of the pain. Sometimes working on the cause of the pain might take away the pain or help this patient get better. But what is also important is that the treatment might include medication. We usually use medication to help with pain. I'm not saying there are people who will get medication and the pain will go away completely. But there are those who will get medication and the pain will reduce, but we stay with some little pain. This little pain, you might find there are other concerns we have that bring about this pain. And when we address them appropriately, the pain will disappear. For example, we shall have treatment modalities like physiotherapy. Very important.
Before we speak about physiotherapy, I was just going to bring something to your attention where yesterday we had a discussion with a colleague, and not a colleague, it was somebody who visited a patient actually, and he told us that there is a certain hospital in Kampala, they're very good at managing pain. You will never feel pain in their presence. They have everything for every type of pain. But what's the danger in trying to alleviate pain when there is an underlying problem in the leg, for example?
Reducing pain is good for the patient because it stabilizes them. They feel better. They're even able to tell you more stories about their pain, and you understand more. Because once a patient comes in and they are in a lot of pain, you might even fail to get a lot of information from them about their pain, which is very hard. So reducing the pain is good, but trying to fight pain minus understanding the cause of pain could be dangerous. Because the patient will tell you, you gave me painkillers today, but my pain is still there. So if you don't assess thoroughly, you'll go for maybe increasing the dosage of the drug you have given before, or giving a new drug, which might not even be necessary. You might find that there are other forms, there are other modalities we could use to take away that pain. But because of not taking your time to assess and examine, you work on the interest of the patient because they have told you we need what? Painkillers.
And painkillers, I'm a strong, I don't know the opposite of the word advocate. I don't advocate for painkillers. I just think it's wrong because this pain signals something is wrong. Something is wrong. So I believe having to
the word is misusing the painkiller.
Or misusing the painkiller.
But for us, when we use them correctly and appropriately, they're okay. But people misuse the painkillers, especially at home. They won't come to know the cause of the pain, and will keep taking painkillers. The painkillers in the long run will affect their health, which is not important, which is bad.
So at what point would surgery be considered? and I don't think it's only just cutting the leg.
Surgery is one of the treatment modalities we use to manage leg pain sometimes. Because someone might have a fracture, and you want to manage this fracture surgically. You want to do some surgical procedure to manage this fracture. So surgery is important. There are people who have had issues with blood vessels and they need surgery. Of course, like blood clots, they could give medication to prevent blood clots from forming. or breaking. But in other cases, surgery might also help.
Yeah. And we're about to wind up to get out of here, but what are some of the risks of ignoring persistent pain or a dull ache where you just ignore it? And
Persistent pain might get you into a disability. You can get into a wheelchair because you have had leg pains for so long. You can't move. When you have pain in a joint, and the joint is so painful, you cannot move.
sometimes
And
it's very dull, you know, and ignorable.
yes, yes, but sometimes that pain might come with other symptoms. You might have the dull pain, but with some sort of numbness. Numbness is a form of paralysis. So you can have pain, and at the same time you have paralysis, which comes, of course, gradually, like you say, and you are moving on slowly, slowly. But in the long run, you might end up with poor muscle work. Your muscles become weak. You cannot stand for 2 minutes. You cannot walk for 5 minutes. And you end up in a wheelchair.
How dangerous is paralysis?
Paralysis is very dangerous, depending on on which part of the body has got paralysis. But of course, in this case, we are talking about the leg, not so worrying, because if it is general paralysis, it can affect breathing and you might lose life. But for the leg, someone might be like, I see it is only the leg. But when you get paralysis of the leg, you might disorganize the whole system of the leg. One, you are not going to use the leg. Two, you get wounds and you don't know.
Oh, you don't know.
Pressure sores.
Speaking about wounds that you do not feel as we wind up, I have seen that method that the Chinese use, or I could say from the East, where they use those small needles that it's called acupuncture.
Acupuncture, yes.
Is that
Yes,
something you've
it's
used?
also helpful. Actually, some people here in Uganda use it.
Is that to awaken the nerves?
And also managing pain, yes. Because we are when we are managing pain, we make use of the nerves.
Okay.
Because the nerve, the pain moves along the nerve pathways. So sometimes when you desensitize the nerves, the pain will go away. Yes.
And finally, the use of massage, managing all of
Massage is very important in managing leg pain. It's very important modality, even in hospitals. But we need to be careful with massage. I don't support people who go everywhere for massage. You should go to a trained physiotherapist or massage therapist, because these people have the knowledge of the anatomy. They know the human body. Do you know this is that. When I do this, I'm doing this. But some people are doing this because of business, and they don't have any idea about the anatomy of the human body. I told you the issue of the blood clots, very important.
Yeah.
High blood pressure, you need to consider it.
Okay, so we are done here. Thank you so much, Ambrose, for coming. And we shall most definitely have you on the show again. And we appreciate your time. Thank you, dear viewers, for tuning in to NTV Uganda, for watching NTV Medical Matters. My name is Viola Sasira. And before I had forgotten, actually, please help me share your contact for our viewers.
Yes, because most people usually want to know more about health. My number is 0706 63 9950. 0706 63 9950. Ambrose Asimwe. Get me through that number and we talk about health.
Thank you, Ambrose, again. And I just wanted to let you know our episode will be up on YouTube, NTV Uganda, so you can always extract the number from there. And thank you so much for always watching NTV Medical Matters. We shall catch you again on the next episode. I am Viola Sasira. Have an amazing week.